Which are the most important points for an appropriate antibiotic therapy?
Yeah, when we talk about adequate or appropriate antibiotic therapy, I think it's very confusing to some clinicians, but we're really talking about several things. Number one, it's an antibiotic that's active against the organism causing the infection, but in addition to that, we need to be sure that we dose it appropriately so that it gets to an active level at the site of the infection, and that we give it for an appropriate duration of time in order to treat the infection, but not too long, which might increase the risk of resistance.
Timing, you said, is crucial in serious infection.
Yes, timing is crucial on both ends. From the front end, we have to get the drug on board as early as possible when we really are dealing with a patient who has a serious infection. But on the other end, the back end, we also need to think about, okay, when can we stop the drug? Because the sooner that we can stop therapy, the less likely it is that resistance will emerge.
Is our armamentarium adequate?
Yeah, the antibiotics that we have serve a purpose, and many organisms still are susceptible to the antibiotics that we currently have in our armamentarium. But the problem is that on a global perspective, we're seeing more and more organisms that are resistant to the agents that we already have, and so we do need new drugs. The new drugs need to be used according to the likelihood of the patient having an infection with one of these resistant organisms, and we need to try to preserve these new drugs for as long as possible.
Are there a resistance in the approval of new antibiotic from the regulatory agency?
Yes, I think that some regulatory agencies will resist the entry of new antibiotics into a marketplace because of issues related to cost or potential toxicity or the lack of efficacy data. But in general, if it's a drug that has been demonstrated to have good activity against a highly resistant organism for an indication like pneumonia or intra-abdominal infection, I think it's going to be very difficult for agencies not to approve those new agents.
Which are the difficulties of the studies in this field?
Yeah, I mean, when it comes to collecting data, it's usually easier to do it when you're conducting a registration trial with a new antibiotic. The more difficult challenge is for hospitals to collect their own data in order to really have an accurate picture of what their local epidemiology is. And I think that hospitals need to be encouraged to have that data, even if it means investing in those hospitals to give them the mechanisms and the resources to actually put that data together. One of the most important messages I can leave you with is that for clinicians like myself working in the intensive care unit setting, we really should be focusing on establishing the best practices for the care of our patients who have serious infections. Sometimes that may mean increasing the overall cost for managing that individual patient from the standpoint of collecting cultures, the microbiology, and even the treatment. But in the long run, if we can improve patient outcomes, that can lead to reductions in overall healthcare costs, and that again really is the best practice that we should be achieving.